The manual version of the Hoyer lift has a hydraulic cylinder and hand pump with a weight capacity of 400 pounds. It comes with various sized U-slings to fit patients of different heights. Remember to take off footrests and lock the wheels on the wheelchair prior to the transfer. Explain the lifting sequence to the patient before attempting to lift them the first time. If in a hospital bed, raise the level of the bed to the highest position before moving the patient onto the sling. When the patient is ready to be lifted, lower the side rail and level of the bed, decreasing the distance the patient has to be elevated. The sling should support the person's head, midsection, and buttocks. As you can see, Stephen would need a much larger sling. To position the sling correctly, roll the patient to his or her side first and ensure that the top of the commode aperture or U-shape is at the base of the spine. Bring the leg support straps up and around the thigh, then cross them between the legs to provide greater security and prevent the patient from sliding out of the sling. Roll the base as far into the bed as possible, locating the cradle over the patient. Turn the knob to lower the cradle. Be careful not to lower the frame onto the patient. Use the parking brakes to stabilize the lift. Do not attempt to lift the patient with the mast assembly swiveled to either side. The patient's weight must be centered over the base legs at all times. The sling has loops that are color-coded so that it's easy to keep straps of equal length on each side. Attach the shortest possible loops. When both sides of the sling are attached to their respective sides of the cradle, raise the patient slowly. Unlock the wheels and use the foot pedal to widen the base and maximize stability. Carefully move the lift and position the patient above the wheelchair. Lock the lift and slowly lower the patient into the wheelchair. Once the patient has been lowered, maneuver the cradle handle to avoid contact with the client. Then remove the sling from the frame. Lastly, cautiously remove the sling from the patient to preserve skin integrity and provide maximum amount of comfort for the patient.
Before performing the lift, engage the brake on the bed. Then lower the rail on the side that will be receiving the lift. Move the resident and wheelchair as close to the bed as possible. Engage the wheel locks on the wheelchair. Move the front riggings out of the way. Position the sling on the resident. Have the resident lean forward in the chair. Take the sling and slide it behind the resident with the smooth surface against the resident's body and the grab handles outside. The sling should be positioned between the top of the resident's head and the base of the spine. Make sure it's straight and parallel to the resident's shoulders. Push the bottom of the sling down to the seat. Position the straps as far forward in the seat as possible. Have the resident lean back in the chair. Lift one of the resident's legs. Reach under and pull the sling out until it's just behind the resident's knee, about 3 inches. Repeat the procedure for the other leg. Be sure that the sling is clear of the wheelchair's front corners. Move the lift into place. Make sure that the lift's legs are in the maximum open position for stability. Use the shifter handle to open the legs of the lift. Position the lift so it's over the wheelchair. Lower the boom so you can attach the sling to the swivel bar. Lock the rear casters to secure the lift. Position the swivel bar so that it's parallel with the resident's shoulders for proper attachment. Then, attach the sling. First, attach the straps that are by the resident's legs to the front of the swivel bar. Just make sure that you use the same color straps for both legs. Attach the top straps securely to the swivel bar hooks that are closest to the resident. Again, making sure you use the same color straps for both sides. Make sure the resident's arms are inside the sling. Unlock the rear casters. Press the up button on the hand pendant to elevate the swivel bar and put a slight amount of tension on the sling. Double check to make sure that all sling straps are properly attached to the swivel bar. If they are not, lower the sling and fix them. Start the transfer. Press the up button on the hand pendant until the resident rises to a point just above the wheelchair. During the transfer, the other caregiver can use the sling handles to maneuver the resident. Use the push handles to slowly move the resident toward the bed. Rotate and position the resident over the middle of the bed. Press the down button on the hand pendant to lower the resident onto the bed. Once the resident's full weight is on the bed, lock the lift's rear casters. And unhook the sling from the swivel bar. Unlock the casters and move the lift away from the bed. Remove the sling.
Okay. Got it? Yeah. Oh, that was
This video will demonstrate diaper changing procedures. These are some of the items that you may need. Survey the environment and minimize hazards such as wet floor, loose rugs or wires. Ensure privacy by closing the doors and drawing the curtains. Place items within easy reach. Before procedure, wash and dry your hands thoroughly. Put on your personal protective equipment. Approach the elderly gently and explain what you are going to assist her in. Assess the elderly's readiness and alertness. If the elderly complains of giddiness or increased pain, do not carry out the care procedure. Position the elderly in supine position. Peel off the sticky label and unwrap the front part of the diaper. Check for broken skin, pressure ulcers, bruises or rashes. Record and report any abnormalities. Check for foul-smelling or cloudy urine, discharges, loose bowels or bleeding in the bowels. Clean the genital area gently and thoroughly. Check the skin condition as you clean. Tuck in diaper end that is furthest away from you under the elderly's body. Turn the elderly on lateral position, facing away from you. Clean the bag gently and thoroughly. Check the skin condition at the back for broken skin, pressure ulcers, bleeding or rashes. Roll the soiled diaper neatly without contaminating the surrounding linen. Dispose soiled diaper properly. Remove soiled gloves and dispose appropriately. Change into a new pair of gloves. Tuck in protective sheet. Tuck the new diaper under the body. Apply moisturizing or protective cream on dry skin areas or bony areas to prevent pressure sores. Turn the elderly back to supine position. Adjust diaper. Apply moisturizing or protective cream, especially around the groin region. Fasten diaper tape securely. Check elderly's response for any discomfort. Remove personal protective equipment without contaminating the surrounding. Dispose dirty clothes appropriately. Clear and store items used neatly.